السلام عليكم ورحمة الله. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على رسول الكريم. أشهد أن لا إله إلا الله وأشهد أن محمدا عبده ورسوله. Assalamu alaikum wa rahmatullahi wa barakatuh. I want to welcome everyone to the ISB Healthy Task Force Town Hall. This is our fourth meeting of this type. I want to remind everybody at the very beginning that if you have a question, please send it to healthy@isb.org. Healthy@isb.org. Then we will be able to address the question as we come closer to the end. Also, if we find a spot where it makes sense for us to answer the question in the middle, we'll do that. So inshallah, let's get started. I want to remind everybody that today there is a rally. It's co-sponsored by CARE, the ICNA Council for Social Justice, as well as the Howard County MASJID, Muslim Family Center, Maryam Islamic Center, and Dar al-Taqwa. So make sure 5 p.m. to 7 p.m. We will purposely try to keep this under 45 minutes. So those of you who want to travel there, we will also be reminding you about safe protesting as far as social distancing and in light of COVID. But for those of you who want to show solidarity with Black Lives by Muslims, the solidarity rally for Black Lives by Muslims of Howard County, 5 p.m. at the Columbia Lakefront. And parking may be a little difficult, so you may need to park across at the mall and then walk over. But inshallah, we'll get started. I want to remind everybody from the very beginning that although Dr. Ndama Bamba, Dr. Najla Abdurrahman, and myself are physicians, we are not your physician. And therefore, please, if you have any issues or concerns that are related to your own health or the health of your loved ones, make sure you contact your primary care providers for your specific needs. And everything in this presentation is updated as of today, which is June 7th, 2020. So if you happen to be watching this later, news, knowledge, etc., may have changed. So this is as of June 7th. So now, generally, we're going to cover very quickly recap some of ISB's response to the COVID-19 outbreak. Then I'll do that, and then Dr. Ndama Bamba will cover Maryland's response and the current status within our state, and then we'll go through questions and comments. So very quickly, ISB Healthy Task Force was formed very early in the process, February-ish, and the idea being that it could advise ISB's leaders and both at the operational level, at the strategic level, and then also coordinate with the resident scholars and administrations of all the various entities, be it Quran Academy, a Rahma School, a Rahma Sunday School, a Rahma Nursery, etc., as well as the MASJID itself on when to open, when to close, how to have proper procedures, etc. So the ISB Healthy Task Force is made up of 6 physicians. Over time, we are adding more. There's several more have asked to join from multiple disciplines. And so as we sort of emerge out of the COVID-19 outbreak, we will focus on other aspects of health and wellness, everything from physical activity and less stress and behavioral health, mental health, spiritual health, and nutrition as our cafe opens, etc. But just want to recap quickly some of the things that have happened. So in addition to providing advice, the ISB Healthy Task Force helped form the My Nurse program, which is a nurse sort of on call that allowed to answer questions that our community had, and they also helped us on when to close and how and when to reopen. In addition, advising on everything from cleaning supplies to cleaning procedures to how to maintain social distancing, entering and leaving, etc. So this just to remind you that we did reopen somewhat on June 3rd for the 5 daily salahs. We purposely waited until after Eid, feeling that first of all, the county regulations required that. Also, Eid itself would have been much more difficult logistically to manage. So we started on June 3rd, which was the Wednesday at Maghrib time, and essentially offer 5 daily salahs in the gymnasium. And so we have a way to enter following there's markings on the floor. And you may have seen a video where I'm just sort of walking through some of the procedures of that. and then we pray in the gym, and then as we leave a different way. And in between the salahs, we do our best to clean all the surfaces, etc. But also try to keep everything open so that you don't have to touch any of the surfaces. A reminder that if you do come for any of the 5 salahs, we do not have direct access for wudu facilities. And so also we require that you come with a mask and with a prayer rug, which is checked as you enter the parking lot. As you enter the parking lot, they check the temperature and whether or not you have a mask or a prayer rug. And sometimes we do that check at the bridge as you cross over. Sort of depends on the logistics of the particular salah. So just want to show you, this is what it looks like inside of the gym. We have those X's on the floor where when you come in, you put your prayer rug on the X. By the way, those X's, although physical distancing or social distancing is recommended to be 6 feet, those are slightly more than 6 feet, actually 8 feet, to allow for the space that we ourselves occupy. So they're slightly more. With those markings, it's 8 feet in either direction, in all directions, actually. And that means that our gymnasium can hold 108 prayer spots as we mark them out that way. So we are restricting access when it exceeds that number. So Jummah prayers were offered this past Friday, and because of rain, we did not offer them outside, or the threat of rain. We offered them in the men's musalla, the original musalla, or the larger main floor musalla, second floor, and the gymnasium. All prayers are limited to people over the age of 15 and those who are not sick or exhibiting symptoms. So anyway, those are the prayer times for Jummah. I'll show you on the next slide here. This is a top-down view of the campus. The larger box is where we will be praying outdoors. Again, you will need your mask. You will need your prayer rug to be able to get into that section. The imam will lead, for those of you who are familiar with, essentially right where that W is for width. That is a spot where the imam will stand, and everyone will be in rows behind the imam. And those rows will be marked off in that space. And if we need to, we can go inside if we must. There will also be space for sisters in the gymnasium as well. Elders, if it's sunny and hot, etc., elders will have seating area underneath the pillared area beneath the men's musalla, right before the main lobby. But people will not be entering the building in general. So these are the general procedures. Again, you will not be allowed in. So some of you may have been turned away. I do apologize for that, but at the same time, recognize that this is for the greater good. So inconvenience of a few sometimes is necessary. So inshallah, let's quickly cover some of those safety guidelines. I mentioned if you're feeling sick, stay home. If you're older than 65, it is recommended that you pray at home. If there are no children under 13 allowed, we maintain social distancing on the way in, on the way out, and while praying. There's no clustering or anything near shoe racks or anything. In fact, when you come in, when you pray in the gym, you put your shoes next to you, so you keep your shoes with you. And when we prayed Jummah in the musalla, we gave out plastic bags that you carry your shoes with you in the plastic bags, so that there's no clumping of people next to shoe racks while they put on their shoes. Again, you must wear a mask. There are no exceptions to this, and recommended you do wudu at home and bring your own prayer rug. And for those of you who want to read the Quran, please don't share, don't bring it and share it with others. If you have, it's better to just read it on your device and keep that device with you. Also, please do not share your prayer rugs. If you're leaving one Jummah and you see someone who doesn't have one, don't hand it off. The point is that we keep us all safe and separate. So I don't know if Dama, do you want to start going from here on out? Quickly cover the nature of COVID.
Sounds great. Can everyone hear me okay? Assalamu alaikum, everyone. Yes. Okay, so we've discussed this in the past. Coronavirus is a family of virus. It's the second most common cause of cold and is commonly associated with outbreaks, including that like SARS, MERS, and now COVID-19. So coronavirus 19 was first identified in China, and since then it's traveled across the world, hence the pandemic. Although it's typically associated with respiratory illness, it is also associated with systemic illness. In other words, we're finding that individuals are presenting with effects of COVID-19 in other parts of their body, like as presented by stroke, as well as kidney dysfunction. And it's resulted in 6.6 million infections worldwide and about 300,000 deaths worldwide to date. Next slide. So symptoms commonly associated with COVID-19 includes cough, fever, shortness of breath, diarrhea, body aches, loss of smell and taste, sore throat, runny nose, confusion, weakness, and numbness. Now, this slide here demonstrates whether this is a sign of COVID-19. It's not officially confirmed by experts. However, podiatrists or feet experts and then dermatologists, skin experts have noted that among children as well as young adults, they're seeing inflammation of like their toes or their hands. Hence the reason COVID toes. They've noted that it's something that's been seen in children or young adults that don't have symptoms or have mild symptoms. So this is something to keep a lookout for. If you happen to notice something of this sort, consider contacting your healthcare provider. Next slide. Also recently, about a month ago, in the United States, there was mention of a phenomenon in children. Now, many of you may step back and say, hey, I thought that the experts said that children would not be impacted. And originally that was the idea, the thought process. This condition, which is known as multi-system inflammatory syndrome in children, is rare, but it is known to cause inflammation throughout the body, including areas like the heart, the skin, the vessels as well. These images are just kind of examples of what one might see. For example, A shows the inflammation on the abdomen. B shows a diffuse rash that's associated with this condition. C shows more of like the bruising type of lesions that one might see on the skin or the hands. And then D shows some lesions that are on the feet. Some other symptoms associated with the condition also includes like fever, bumpy like tongue, which is associated with a strawberry tongue. You may also have like non-specific symptoms like irritability, abdominal pain. If you find that these are symptoms that a child has, then consider contacting primary care provider or healthcare provider. Next slide. So let's delve into the response in Maryland. Next slide. Since the last time we met, several things have happened. Alhamdulillah, the Maryland Department of Health issued a guidance to allow hospitals as well as clinics to start elective procedures. They've also lightened the restrictions so that individuals could engage in safer outdoor activities like golf, fishing, camping. And then we also learned that schools would remain closed for the remainder of the school year. Next slide. So the road to reopening or recovery in Maryland is based off of 4 building blocks. This includes expanding testing to a goal of about 10,000 tests per day. Alhamdulillah, the state of Maryland has achieved that. As well, we all, or many of us may be aware of the governor acquiring 500,000 tests from South Korea. The next step was increasing hospital surge capacity. Currently in the state of Maryland, we are able to provide care for about 8,100 individuals across the state. Alhamdulillah, currently we're only using an eighth of that. So about 1,000 hospital beds in the state is currently being utilized to treat and manage individuals who require hospitalization for COVID-19. We've ramped up the supplies of PPE. There's increasing stockpiles of supplies at the state level. And there's also efforts to ensure that hospitals have access to personal protective equipment. And then the last building block, which is very important, is the building a robust contract tracing operation. And the reason that this is important is that you may or may not know, we do not yet have a vaccine. So one of the methods that we'll be using to decrease the further spread of COVID-19 is by identifying those individuals that have COVID-19, whether they're healthy and they don't know that they have it, so they're continuing to interact with individuals so that we can hopefully decrease that continuing spread throughout the state. Next slide. So as of May 15, we transitioned to stage 1, which was pretty much the lifting of the stay-at-home order. Houses of worship were encouraged to resume worship outdoors. Some retail stores opened, and this was all under the guise that Marylanders continue to wear a face mask. The other caveat behind this is that for those individuals that live in the Big 8 counties, their local government leaders, whether that's the mayor, for example, Baltimore City, or the county executive, for example, Baltimore County, they were given the responsibility or the discretion to determine when one would advance to stage 1 or stage 2 and further. Next slide.
Actually, I'm just going to add to something to this. I want to remind everybody that it's physical distancing and masks, not physical distancing or masks. And a lot of times there seems to be some confusion there. But the fact is, we need to maintain distance and we need to be wearing our masks. If you have a mask on, it doesn't mean that you're safer by being closer or anything like that. So please practice both.
So stage 2, alhamdulillah, began at the state level this past Friday, June 5th at 5 p.m., where non-essential businesses were lifted. So in other words, non-essential businesses were given permission across the state of Maryland, with the exception of the Big 8 that we've mentioned, have opened their doors. The other thing was that those that are at nail salons as well as tanning salons, they were also given permission to open at about 50% capacity with strict adherence to safety precautions, including measures that Dr. Tori mentioned, such as wearing a mask as well as maintaining physical distancing. And then effective tomorrow, June 8th, the state of government or the state of Maryland will begin its process for normal operations. Next slide. So although we're not yet there, we can continue to hope for, inshallah, stage 3, which we know likely would be based on measures such as decreased daily numbers of cases or decreased positivity rate, decreased hospitalizations, as well as decreased ICU admissions. Inshallah, upon reaching that stage, one could presume that one would be allowed to engage in large social gatherings, attend high-capacity restaurants. There would also be loosening of restrictions on visits to places like nursing homes, as well as entertainment venues like movie theaters. And then the other thing, which is very unique to our community, the permission for large-scale religious gatherings like Eid. We know as a result of the current recommendation of no gatherings of 10 or more, we weren't able to hold the Eid as previously done. Next slide.
And I'll add to this that even if the state announces the stage 3, that does not mean that we will ourselves engage in large-scale religious gatherings. That will still depend on our ability to handle logistics and the concept of shura between the ISB Healthy Task Force, the resident scholars, the leadership, the staff and the volunteers who are actually carrying out the things. So just want to keep that in mind. You should pay close attention to your masjid and their alerts that are going out through their emails, etc., as to whether or not they're opening. Just because the state announces it or the county announces it, it doesn't mean that individual facilities feel equipped to do so. So it will depend locally.
So with that said, inshallah, may we eventually get to stage 3, but as mentioned before, we're currently at stage 2, and that will be largely based on several measures that inshallah we'll go over now. Before I go into the specific slides, I just want to give the major take home that alhamdulillah, we are making advancements or progress as it relates to the number of daily cases, the hospitalization rates and ICU rates, but that's not exactly a green light for us to just relax. COVID-19 is still present in our community, is still present in the state, is present across the world. So let us continue to engage in safety measures, social distancing or physical distancing, wearing a mask, etc. Next slide. So as of today, in the state of Maryland, there are 57,793 cases. That pretty much represents an increase of 491 cases from yesterday, which is good because since about April, on average, there's been an increase of about 600 to about 1,000 cases. We can confidently say that the curve has well been flattened. We can see that the doubling rate has drastically decreased. The last time we can probably note that there was doubling was probably earlier in sometime in April. Next slide.
One thing to note is that we have some activities going on that may change those, and so we're keeping a watchful eye. That would be Memorial Day and protests may change the numbers. So we're going to keep a close eye on that.
Yeah, we're also, inshallah, provide some recommendations for safety measures that one can take to hopefully, inshallah, help us either continue to maintain our current rates or, inshallah, contribute to decrease rates. This slide here is a breakdown of the COVID-19 cases by age. And what this slide just pretty much confirms or still affirms that those that are under the age of 60 continue to contribute to majority of the cases, while those that are above the age of 60 tend to suffer from serious complications, including death from COVID-19. Next slide. So this slide here is just a graphical representation or more of a pie chart, where the main point of this slide is to demonstrate that 87%, about 90% of all deaths attributed to COVID-19. So of the 2,625 deaths in the state of Maryland attributed or believed to be caused by, not believed, but attributed to COVID-19, 90% of them, or about 90% of them, were in individuals that are age 60 and above. Next slide. The other point to keep in mind is that as a result of the high mortality, that's also part of the rationale for us encouraging those that are 60 and above, or what I like to call young at heart, to consider maintaining their salat or their prayers at home. Although we do respect your desire or your willingness to come to the masjid at your own risk. So this slide here just is a breakdown of the cases of COVID-19 throughout the state of Maryland. And the main take-home point from this slide is that COVID-19 is not equally distributed across the state. The point of this slide is to show that there's about 18 counties in the state of Maryland, and the big 8, which represent the counties along the Baltimore-Washington corridor, we make up 88% of the cases throughout the state of Maryland. So that's likely influencing why the leaders at the local level, the county executives, the mayor, et cetera, have been tasked with the responsibility or the discretion of determining when we progress to the latter stages. So as mentioned previously before, we may, at the state level, there may be recommendations or the okay that we can progress to to the next stage of recovery. However, based off of the information in our local jurisdictions, our local areas, our local leaders, as well as our places of worship like ISB may utilize additional considerations for slowing down that rate of reopening or lessening the restrictions that we currently have in place. Next slide. This is just a further breakdown to demonstrate that Montgomery County and Prince George's County alone represent 50% of the cases of COVID-19. So as we're traveling more, there's less restrictions. Now, inshallah, please be careful and please be mindful of where you're traveling and continue to take precautions such as physical distancing, wearing a mask, washing your hands as often, or using hand sanitizers. I'm sorry, what were you saying?
And not touching your face after touching surfaces.
Exactly.
In fact, right now I have a major itch on my left eye and I'm dying to scratch it, but I can't because I'm on TV. All right, so here we go.
So after all of those slides, you might be wondering, should Maryland really open? And the next two slides might give you more context as to why we are continuing or progressing towards the stages of reopening or recovery. So as of April 30th, that was pretty much the last time that we had a peak. Since that time period, the rates of hospitalizations as well as the need for ICU admissions have decreased. Overall, there have been some small bleeps for those who experts or individuals who read a lot of data out there, but all in all, you can see that the slope or the rate of the line is decreasing as time progresses, which is a great thing. Okay, it pretty much indicates that the hospitalizations as well as the ICU numbers have decreased with time. Next slide. So this slide here, it shows two things. There's the percent positivity, which is pretty much a ratio. It's the number of individuals who test positive over the number of individuals tested. And then also it gives us a breakdown of the testing volume. So just to be clear, let's start with the testing volume. The testing volume represents the bar graphs, the little bars that you might see that's blue in the background. So what it shows is that with time, we've increased our testing volume, and that, alhamdulillah, since about May, we've been able to consistently test at least 10,000 or more. Now, this relates to the percent positivity because we know that in spite of performing at least 10,000 tests or more, we're seeing that the number of individuals that test positive is low. Now, today, the percent positivity is 7.63%, which, excuse me, which is an all-time low, which is a great thing. The other thing to keep in mind here is that some individuals, they use the percent positivity as a rough estimate or a rough gauge of the burden of disease or about how much COVID-19 might be in the state. So we can probably, as a rough estimate, say that there's probably about at least 7.6% of the population with COVID-19. So we're not out of the woods in spite of us lifting restrictions and moving to and advancing in the stages of recovery. So please keep that in mind as you continue with your day-to-day activities. Next slide. So this last slide here is to hopefully provide additional glimmer of hope, where in the upper right-hand corner, you'll see that the green box pretty much encircles Baltimore County, which as of today, the percent positivity. So the number of individuals that tested positive over the number of individuals that were tested was about 6.6%. So it's actually lower than the state average as of today. Inshallah, hopefully that'll continue. And the reason that I really wanted to indicate that is we know that with the advent of events, including Mr. Floyd, several other individuals throughout the country, many of us have been moved to protest and exercise our voices, our outrage, etc. And with that said, we want to encourage you to continue to implement safety measures, continue to wear masks, continue to remain at least 6 feet apart, so that, inshallah, one does not contract or become infected. There's increasing reports, especially in other states, that protesters are returning with positive tests after being positive COVID-19. So with that said, we want to encourage you to continue to exercise your voice, but also continue to be safe while doing so. Next slide. Take home points. The state of Maryland has entered stage 2 of its recovery/reopening plan. Like we've mentioned before, for those that are residing in the Baltimore-Washington corridor counties, as well as Baltimore City, our local leaders will open, or we will enter stage 2 pretty much at their discretion. The other thing to consider as well is that, as we've mentioned multiple times, is that COVID-19 has not been eliminated. So although, alhamdulillah, we're no longer at rates at about 25% or so, we know that COVID-19 still exists. So we're not out of the woods. This isn't a time to lessen our safety measures. In actuality, please continue to wear masks, wash your hands, social distancing or physical distancing. And we've kind of reiterated that, or we've kind of mentioned that a few times. I do feel like a broken record at this point, but it's really to try to encourage you to remember that, the measures that we take as a community will not only keep us, keep the individual safe, but also keep those that we care about safe as well. So be kind and be kind to yourself as well as those that you love. Next slide. So we've mentioned them, but just to kind of bring things home for COVID-19, we want to encourage you to stay at least 6 feet away, maintain physical distance, wash your hands for about 20 seconds, make sure that you scrub, make sure that you don't forget your thumb as well as your nails. And the goal is to make sure that you thoroughly clean your hand. If you don't have soap and water, do not fret. There's also hand sanitizer. Make sure that you use a hand sanitizer, though, that has at least 60% alcohol. Wear face coverings, whether that's a mask. Make sure that you cover your nose as well as your mouth. That will protect others from whatever you may have and will protect you, inshallah, that the others are wearing a mask from your being exposed to whatever it is that they may have. Avoid touching your eyes, nose, mouth, and some people would also say your ears, the inside of your ears with unwashed hands. And we know that currently COVID-19 is contracted mainly from person to person, and that's hence the reason why we're saying to maintain physical distancing, but also keep in mind disinfecting commonly touched surface areas, because we know the risk of contracting or getting COVID-19 is not zero from touching commonly touched areas. And then the self-explained condition, make sure that you, I apologize, it's self-explained, make sure that you stay away from those that are sick. Next slide. So this is just a reminder that we've discussed many things, and in the event that you don't have questions during this 45 minutes, you're more than welcome to call the My Nurse program at 443-551-4951 to ask further questions that you might have about COVID-19. We're also doing phone screening for COVID-19. And if you don't happen to have any questions about COVID-19, that's totally fine. You're more than welcome to call 443-551-4951 for general health information that you might have. This service is available Monday through Friday from 8 a.m. to 1 p.m. Next slide. Summer is officially 2 weeks away. So this is just a plug that ISB has a summer camp, which will start, inshallah, from July 6th to August 14th. And they are accepting children and young kids between the age of 4 and 14. Next slide.
And that's a virtual summer camp.
Yes, virtual. So again, as mentioned earlier, there is a rally for solidarity for Black lives by the Muslims of Howard County. That's actually at 5 p.m., which is not too far from now. So, those that are out there, alhamdulillah, please continue to exercise your voice, but do it in a safe manner. We're uniquely positioned to not only speak out against injustices, but we also have a responsibility to make sure that we don't harm ourselves or others. So, wear a mask, maintain physical distancing, and if you have hand sanitizer with you, use it often and maybe share it. Next slide. So these are resources for more information. You can utilize the ISB resource page, the Maryland Department of Health, the Centers for Disease Control, as well as the state of Maryland, the Maryland Department of Health website, as well as Governor Hogan's website. Next slide. Jazakallah khair for listening. And, I'm sorry.
Yeah, no, go ahead. No, that's good. Go ahead.
Please feel free to send us your questions, comments, and/or concerns at healthy@isb.org.
And so far, there is one question The question is, Assalamu alaikum. Now that Jummah is reopened, is it compulsory or fard for men to attend? And what if they have small children at home and want to minimize the risk of infection? Jazakallah khair. So, again, as I mentioned earlier in this session, we make all of our decisions in consultation with ISB Healthy Task Force, with leadership, and with our resident scholars. And so some people have asked, actually I'll address a few questions that some people have about Jummah in particular. So yes, in general, that it has, and I'm saying what the scholars have told me, that Jummah is fard on men who are able to attend. However, there are some exceptions. As we know, there are some exceptions in terms of travel and in terms of hardship, and there is one for fear. So in general, if you are attending Jummah, you should, of course, adhere to what the leadership says as far as how to perform the Jummah. The second, if you are not performing Jummah in congregation at the masjid, you should pray Dhuhr instead of praying Jummah. If you have enough people to make your own Jama'ah and have somebody do a khutbah and lead, then you can pray two behind that imam, whoever is leading that. But in general, for the average person that does not have access to Jummah in congregation, then you should pray Dhuhr Salah at that time. And then any questions you have, you can direct to our resident scholars. As far as the spacing, some people have said this is a bid'ah, this is an innovation, we're not allowed to do this. And so our resident scholars are in agreement that we are allowed to pray like this. And in fact, it had happened in Islamic history in the past for some physical distancing in some locations. So we do pray that way. If you are not comfortable praying that way, you are perfectly all right to pray somewhere else or at home and pray Dhuhr instead of joining us in congregation. But until the recommendations are otherwise, and until we can ensure the safety of our community, we will adhere to those guidelines in our prayers at ISB. In addition, I would say that ISB also coordinates with a lot of other masajid. We talk to each other, we ask for feedback, we get ideas from others, we share ideas, we're sharing resources with each other. We are on calls regularly. And this is sort of how we're practicing things. And then sometimes we'll see that one masjid may try something and it's successful, and then we'll implement it, or vice versa. They see that we've tried something and then they implement it. We all agree to sort of take these as learning times, as well as while we try to be safe. I'll also say that along the way, things like the drive-through iftars and all those things that we had during the month of Ramadan. Some of the larger gathering type things will continue to sort of have that flavor. So for those of you who were involved with the Sunday school, you may have known that today was a drive-through sort of festival, sort of graduation kind of thing, and there will be others coming up like next weekend for some of the other entities at ISB, etc. So anyway, we adjust based on those recommendations. Let me just see if there are any other questions. Does anyone want to add anything, either from your experience or related to that question?
So just in general, Asanika, I wanted to mention that if you have someone at risk in your home, an elderly person or someone with medical problems that would put them at increased risk for morbidity or mortality from COVID-19, you want to be mindful of your going out and coming in. Meaning, if you yourself are healthy, you still have to keep in consideration those who you're close to at home and limit your exposures for their safety, inshallah.
I'll add sort of a story. I may be going a little bit over the top when it comes to this, but for those of you who don't know, one of my jobs during this pandemic is to serve as sort of a counselor, a first line emotional support to nurses and doctors who are on the front line caring for COVID patients. So I go to hospitals, onto COVID units, and sort of help counsel those who are serving on the front lines. When I come home, I text my family to say, open the garage. I go into the garage, I close the garage. I hope you guys aren't visual, but I strip down into my underwear. I put all of my clothes into a plastic bag. I run as fast as I can without my kids seeing. They all know to disperse. I go up to my shower, and I shower and wash and all that stuff. And I maintain extended time distance from my elderly relatives and friends. So, and when I am near them, I do wear a mask, and I do maintain that physical distancing, even though in some cases we're in the same household. Just so you know, this is sort of what I'm doing. By the way, as far as the sentiment on the front line, I'll tell you that if you ever speak to any nurse or doctor who is actively taking care of COVID-19 patients, and sometimes we get questions like, hey, do you think this is a conspiracy? Do you think this is some sort of thing? Do you think this is like politics against whatever? And you know what, that there are some questions that typically nurses and docs are used to hearing all kinds of questions from all ends of the spectrum. But for some reason, these questions sting more than usual, because we are seeing sort of a severe side of this disease that many of you are not seeing. And so it's very traumatizing. In fact, the healthcare community is preparing for full-on PTSD, or post-traumatic stress disorder, among its workers, because of seeing what's happening, especially in those counties that Dr. Ndamabamba mentioned when she mentioned Prince George's County, Montgomery County, DC itself. There is some real deep-seated anxiety and fear, even amongst those who are caring for people. Now, the great news is those who are on the front lines, who are wearing adequate protection equipment, they are not necessarily contracting the disease. So it's working. In other words, the physical, the distance, and the personal protection equipment, that is actually, it's working, right? So there are some who have contracted it, but in general, it's something that, but it's stressful for those frontline workers. So just please keep that in mind as far as sensitivity if you talk to anybody who's working on the front lines.
Dr. Toy, if I may, I was going to say, Dr. Toy, if I may add, I'm actually glad that you mentioned your personal routine when you come home, because a lot of healthcare providers, those that travel to clinics throughout the state, may have a regimen where there's use of disinfectants, changing one's clothes, for example. Myself, other healthcare providers, tend to wear an outfit, or wear whether it is that you're wearing the overall suit, or whatever it is that you wore into work, you might wear that throughout the day. And then as soon as you are leaving, you take that off, you're putting on an outfit just to get home. And like you said, engaging and, personally cleaning yourself, your personal hygiene as well. That can be heavy, and from the standpoint of increased laundry. But as was mentioned before, the risk of impacting those that you love, like your elderly family members, children, etc., makes it more than worth it. A lot of people are using, antibacterial soaps, things of that nature, hand sanitizers, the disinfectant sprays, maybe spraying their clothes, taking it off, or using the methods that Dr. Tori mentioned. And then also, for those that may have work bags or items where they know that they're exposed to a lot of individuals, those things are being left outside of the home. So perhaps in the garage, the trunk of the car, so that one can minimize the exposure of things from the outside entering the home as well.
I'll also add this: anybody that is that has a loved one who is hospitalized with it, I would say that the one of the things that I've seen that's often sort of traumatic for both the healthcare worker and for family is that you can't go in and visit. And so many places now have iPads or some sort of tablet device where you can sort of FaceTime with everybody, with the family. I recommend that you do that often, because it is for the one who has it and is hospitalized. They feel very isolated, very alone, and so please, that's actually why they've changed the term from social distancing to physical distancing, because the social aspect is actually impacting all of us in another way, in terms of our mental and spiritual health. And so, if you do need sort of counseling or someone to talk to, please seek out the help of behavioral health and mental health providers. That, you know, right now work isn't normal, home isn't normal, shopping isn't normal, and so it can add to all kinds of stressors to us. And so please pay close attention to your mental, emotional, spiritual, and all the other aspects of your health. So anyway, I've checked. There are no other questions at this point. Does anyone have any last comments before we?
Yeah, so I just wanted to quickly mention, we talked quite a bit about how to prevent, inshallah, from ourselves from getting COVID-19. But I think I just want to mention a few things about what to do if you happen to contract COVID-19. Inshallah, it won't happen, but if it happens, first of all, you want to remain calm, you make dua, and keep in close contact with your healthcare professional. In addition to that, you want to make sure that you're maintaining quarantine for yourself and your family members. I can't tell you the number of patient families that I've dealt with where a family member will come home with a new diagnosis of COVID-19, and then the ones around them will then thinking they're doing the right thing, go to someone else's home, so they're away from the one that was positive, but in the meantime, they were in contact with that person for 2 weeks prior. So in that way, they're taking the illness with them to a new family member's home. So if you are diagnosed, if one person in your family is diagnosed with COVID-19, chances are those who live in close contact with them were also exposed and may also likely have the illness. So they themselves have to be mindful. Those in the family should not be going out shopping and buying groceries and engaging in public activities. However, I understand it's difficult for families, especially if you don't have many friends and other family members outside your home here to help. So if that happens, please call the nurse hotline that Dr. Ndama mentioned, and we can see what resources that the MASJID can offer to help you with getting your groceries and things like that, because it is very important if you are positive or a member of your household is positive that you do not leave your home. But again, keep in close contact with your healthcare professional, and then Nurse Kinza can also offer some other resources that the community may have for you.
I believe a question just came in. Let me just answer that before we conclude. It says, Assalamu alaikum. Now people are coming to the masjid for regular prayers, and you perform temperature monitoring regularly. Will you update the community with any concerning trends if you have observed any? Potentially, yes. So far, I'll tell you right now, we have turned away exactly 0 people for having the temperature that was above normal. So we do have temperature probes that were using infrared probes at the gates. But so far, no one has come with a fever. The only people we have turned away have been for not having a mask or not having prayer rugs. So and that will continue, by the way. So please bring your masks and your prayer rugs. And by the way, if you know there were rumors of people who had been positive in the past and came to the masjid, please again follow the guidelines as Dr. Najla Abdurrahman just mentioned. You know, you should not be going out until you are okayed by a health provider to do so. So do not come to the masjid if you have been diagnosed, and do not come to the masjid if you are sick in any kind of way. Inshallah, this will be the end of our program, but not the end of the resources for you. You see the Nurse Kinza's line phone number on there. In addition, you can email healthy@isb.org with your questions. And I will remind you that if you are going out to the protests and the rallies, please maintain safety precautions with physical distancing and wearing a mask, and please encourage others to do the same. If you're going, bring a few extra masks, bring some sanitizer, bring things to help others that are there, and remind people, and certainly keep yourself and your family safe. Jazakumullahu khair. Assalamu alaikum wa rahmatullahi wa barakatuh. May Allah bless you. May Allah protect you. May Allah protect our community. May Allah allow us to return wholly and fully to the masjid, and to be able to make dua and salah and greet each other again in the MASJID. May Allah lift this COVID-19 from the globe and from our communities. And may Allah give us solidarity and unity and brotherhood and sisterhood, and remove injustice from not only individuals, but also from our institutions and from our governments and our relations with each other. So may Allah protect us all. Ameen. أقول قولي هذا واستغفر الله لي ولكم. السلام عليكم ورحمة الله وبركاته.